Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes, and today we are going to talk about speaking topic first, as usual. And to be very honest, I have never done this topic before, so I'm just going to do that in the way it has to be done in the exam. जैसे एग्जाम में करना होता है बिल्कुल वैसे करके दिखा रहा हूँ. And please subscribe our channel if you have not. It is very important to subscribe, then you get daily videos. So I'm just going to start this topic. Suppose this is the setting. This is the setting of the emergency department. So I have not done it before. So if it comes in the exam and I have to do it for the first time, let's see how would I do it. So first of all, you see a 65-year-old patient who has broken his right shoulder, proximal humerus fracture due to a fall at home. She has been given a sling to wear and is now ready for the discharge. You are giving information about the aftercare and healing. So being a nurse, you need to give. So obviously I can understand. Good morning. My name is this. How are you feeling now? That is the best thing I can say. When the patient is already with us, how are you feeling now? पेशेंट अपनी फीलिंग बताएगा. तो फर्स्ट लाइन मैंने आपको कहा है हमेशा लिखनी है. यू विल गेट 3 minutes टू प्रिपेयर दिस थिंग. सो हमेशा फर्स्ट लाइन को जरूर लिखना है. सो आई हैव अंडरस्टूड कि उसका राइट शोल्डर फ्रैक्चर हुआ था, वो एडमिट हुआ था और अब उसको स्लिंग दे दिया है. सो ही इज फाइन. और ये सब कुछ शायद आज में ही हुआ है. गिव रीजन फॉर सीइंग पेशेंट. तो आप नर्स हो, आप पेशेंट के पास क्यों आए हो. सो आप बताओगे नाउ. जब वो पेशेंट बता देगा आई एम ऑलराइट, आई एम फीलिंग बेटर, सो विल से ओके दैट्स व्हाई आई एम हियर बिकॉज यू आर गोइंग टू get discharged now, and I would like to give you information on how to take care of yourself when at home, and also would like to tell you about the healing process. Find out how the patient is feeling about going home. So are you happy to go home? तो ये बात आप पूछोगे. Give information about the care of shoulder. तो आप बताओगे इमोबिलाइजेशन ऑफ आर्म करनी है, जिसके लिए हमने आपको स्लिंग दी है. 3 weeks तक ये स्लिंग आपके साथ रहेगा. सो दिस स्लिंग विल हेल्प यू फॉर 3 weeks and it will help to immobilize your arm. And also you need to take painkillers on time. It is very important for you to take painkillers so as to relieve the pain. Also you need to maintain mobility of the elbow, wrist and fingers. Find out if the patient is in pain. तो अगर वो अभी भी पेन में है तो आप कह सकते हो कि पेन किलर्स ले लो. अगर वो कहते हैं नहीं अभी पेन बेटर है तो उसको कहो ठीक है, फिर देन इट्स फाइन, बट वेन एवर यू फील पेन टेक पेन किलर्स. और आपको मोबिलिटी मेंटेन करनी है अपनी एल्बो की, रिस्ट की, फिंगर्स की. गिव फर्दर एडवाइस ऑन केयर ऑफ द शोल्डर. तो शोल्डर के लिए आपको क्या करना है, मतलब जो शोल्डर है वो तो फिक्स हो गया है, तो उसके अलावा जो है आपको एल्बो को हिलाते रहना है, रिस्ट को हिलाते रहना है, फिंगर्स को मूव करना है. तो ये पॉइंट है ये वाला. तो शोल्डर तो फिक्स है क्योंकि वो इमोबिलाइज्ड है. गिव फर्दर. और शोल्डर ही फ्रैक्चर हुआ है, राइट शोल्डर फ्रैक्चर हुआ है, तो आपको ये छोटी छोटी इमेजेस बनानी पड़ती है. तो बेसिकली पर्सन की जो भी जैसे आर्म है, ये इफ इट इज द आर्म, तो ये शोल्डर हमने फिक्स कर दिया है स्लिंग्स के साथ. तो ये वाली जो बाकी चीजें हैं इनको मूव करते रहना है. इसके अलावा गिव फर्दर एडवाइस ऑन द केयर ऑफ द शोल्डर की पेन रिलीफ रेगुलरली 3-4 days आपको खानी है. देन एज पर द रिक्वायरमेंट. तो पहले 3 दिन तो खानी है, उसके बाद एज पर द रिक्वायरमेंट. आइस पैक 15 minutes के लिए अप्लाई करना है आफ्टर एवरी फ्यू आवर्स. एक्स्ट्रा सपोर्ट व्हेन स्लीपिंग. जब भी आप सो रहे हो तो आपको एक्स्ट्रा सपोर्ट चाहिए होगी. सो डोंट बी ऑन द साइड ऑफ द शोल्डर एंड एक्स्ट्रा सपोर्ट वुड बी रिक्वायर्ड विद द हेल्प ऑफ पिलो और मे बी विद सम पर्सन. फाइंड आउट अबाउट द पेशेंट जॉब. आप रिटायर्ड हो या वर्किंग हो, फिर वो बताएगा कि आपका किस तरीके का काम है, तो उसको बताना है कि कोई भी स्ट्रेनस एक्टिविटी नहीं करनी है. गिव लाइकली स्टेजेस ऑफ रिकवरी. सो आई वुड लाइक टू टेल यू अबाउट द स्टेजेस ऑफ रिकवरी. पहले हीलिंग ऑफ फ्रैक्चर 6 to 8 weeks, यानी 1 से 2 महीना लगेगा. रिज्यूमिंग ड्राइविंग. तो बेसिकली यहाँ से आपको पता लग गया कि वो ड्राइव करता है, तो आप 2-3 महीनों के बाद ड्राइविंग कर सकते हो. फुल रेंज ऑफ मूवमेंट आप 3 से 4 months लगेंगे. तो प्लीज विग्रस एक्टिविटी नहीं करनी है, ड्राइविंग नहीं करनी है पहले 2 महीने. उसके बाद आप अपनी ड्राइविंग रिज्यूम कर सकते हो. जो फुल रेंज ऑफ मूवमेंट है वो 3 से 4 महीने लगेंगे आपको. वॉर्न अगेंस्ट ड्राइविंग बिफोर 2 to 3 months. अगर वो कहता है मेरे को तो ड्राइविंग के बिना मैं पैसे नहीं कमा सकता, मैं कैसे रहूंगा, तो उसको कोई जरूरी है 2 से 3 महीना आप ड्राइविंग नहीं कर सकते. तो प्लीज आपको तब तक तो नहीं करनी. अगर आप ड्राइविंग करते हो तो फर्दर इंजरी हो सकती है और रिकवरी पीरियड लॉन्ग हो सकता है, रेस्ट्रिक्टेड मूवमेंट हो सकती है, इनएडिक्वेट कंट्रोल ऑफ व्हीकल हो सकता है. तो ये सब डेंजरस हो सकता है एंड कैन लीड टू सम एक्सीडेंट. प्लीज अंडरस्टैंड. आउटलाइन नेक्स्ट स्टेप्स. फॉलो अप अपॉइंटमेंट इन 2 weeks, फिजियोथेरेपी इन 6 weeks. तो आपको 1.5 महीने के बाद फिजियोथेरेपी शुरू करनी है. अगेन थैंक्स टू कैम्ब्रिज बॉक्स हिल फॉर क्रिएटिंग दिस लवली क्वेश्चन पेपर एंड आई एम थैंकफुल टू देम for creating this lovely question paper for us. And Dr. BKM assures you for the best of the best speakings samples. So we help you to prepare the good sample paper. So here is, देखो सिर्फ ये एक लाइन है जो मुझे लिखनी पड़ी है, बाकी सब सिंपल है. So अगर पेपर आएगा तो कैसे बोलना है वो मैं आपको अब बोल के दिखाऊंगा. एंड प्लीज सब्सक्राइब आवर चैनल. So good morning. This is Sorry, I'm not a doctor over here because I'm a nurse over here. Good morning. My name is Bhupesh and I am the nurse for the day. So how are you feeling now? Well, nurse, I am feeling all right, but I'm still having pain. Don't worry. Doctor has prescribed you some painkillers. We have already given you a painkiller. If you are still feeling the pain, I will ask the doctor and will give you another painkiller. Well, nurse, the pain is comparatively less as compared to when I came. All right, then it's fine. Then you need not take the painkillers at this moment. But still, if you will feel pain, then you need to take the painkillers. Now, I would like to tell you the reason why I am here. I am here because now you are ready for the discharge as you had a broken right shoulder. So now now doctor has given you a sling to wear. So it will immobilize your arm. So it will help your arm to rest and you will feel better. And I am here to give you information about how to take care of your arm and the process of healing. So I will explain you the process of the healing and how to take care of your arm once you reach home. Is it all right? Yes, nurse, of course, I would like to know. Okay, that's great. But before that, I would like to ask you, how are you feeling about going home? Of course, nurse, I am feeling great that I would be going home, but I'm just worried about aftercare. Don't worry, I am here to tell you about aftercare only. So first of all, I would like to tell you about taking care of your shoulder. The most important thing is that we have given you a sling. This sling will help to immobilize your arm and shoulder. So it would be there for the first 3 weeks. So the first 3 weeks, you need to immobilize your arm. Also, doctor has given you painkillers. So you need to take painkillers for first 3-4 days. It is very important for you to take painkillers regularly for 3 to 4 days. After that, you can take it as per the requirement. तो जब भी आपको required word दिया होता है तो उसको बोलो as per the requirement. At the same time, your shoulder will be fixed with the help of this sling, but you need to maintain the mobility of your arm, wrist, and fingers. You need to keep them moving, but it does not mean any kind of vigorous activity. Do you understand? All right, nurse. Okay. And now I would like to tell you about further things about your pain management. So apart from taking painkillers, it is very important to apply ice packs for 15 minutes after every few hours. So this will help you to relieve pain because ice helps in vasoconstriction, basically constriction of the vessels. So it relieves your pain. So it is very important for you to have these ice packs. Is it all good? Okay. Also, when you are sleeping, it is very important for you to take extra support and not to lie on the side of the broken arm. Is it all good? Yes, nurse. Okay. All right. So now I would like to ask you, are you working or are you retired? Well, nurse, I am a driver and I drive. Okay. And now I would like to tell you about the stages of recovery as well. May I? Yes, nurse, you may. Okay, then. Proceeding further, I would like to tell you that healing of fracture will take around 6 to 8 weeks, which is basically around 1.5 to 2 months. So you can resume your driving after 2 to 3 months. It is very important not to drive at this point of time because if you drive at this point of time, it can risk there is a risk of further injury and even your recovery can be longer. So please understand at this point of time, driving should not be done for at least 2 to 3 months. Have you understood? Yes, nurse. Okay. And also the full range of movement and strength will come within like 3 to 4 months. So it will take some time. So again, I would like to tell you the stages of recovery just to make it convenient for you. It will take 6 to 8 weeks for the healing. And then driving you can resume after 2 to 3 months. And after that, you can do all the activities after 3 to 4 months. Is it comprehensive? Are you understanding my point? Yes, nurse. Okay. All right. Then I would like to tell you that after that, once you are all right, you can drive the vehicle as you want to and you can resume your driving. And now I would like to outline few steps that there would be a follow-up appointment in 2 weeks. So you need to come after a fortnight. इसे 2 weeks को English लोग fortnight बोलते हैं. So you can come after a fortnight for the follow-up appointment. And also physiotherapist will be required who will help you with the physiotherapy sessions. And that would happen after 1.5 month. That is after 6 weeks. So I hope you have understood everything. Yes, nurse. Okay. Do you want me to repeat anything for you? Well, no, nurse is fine. Okay. So I reassure you that there is nothing to worry. We have fixed your shoulder with the help of the sling. You need to maintain it and not to do any strenuous activity. At the same time, complete recovery will take around 3 to 4 months. You can resume your driving after 2 to 3 months and rest There is a leaflet. I'm giving you this leaflet. It contains all the information about the healing process of after this fracture. So it will help you to know everything. Is it all right? Okay. So here is your leaflet. And if you have any problem, there is a number on the leaflet. You can call on this number anytime and we are here to help you. Is it all good? Okay. Then take care. And now you are ready for the discharge. Okay. Done. So that is how you execute your role play in the best possible way. एंड अगेन मैं आपके लिए बोलता हूँ ताकि मैं धीरे इसलिए नहीं बोलता ताकि मैं आपको बोर ना करूँ, लेकिन वैसे आपको पेपर में अब जब आप प्रैक्टिस कर रहे हो तो आपके पास ये रिकॉर्डिंग डेली आती है, तो प्लीज इसको लिख के देखो. थैंक्स टू कैम्ब्रिज बॉक्सिल अगेन. एंड जब पेपर में एक्चुअल में बोलोगे तो ऐसे बोलोगे, गुड मॉर्निंग, माय नेम इज भूपेश, सो हाउ आर यू फीलिंग नाउ? ओके, ऑलराइट, सो आई हैव अंडरस्टूड दैट यू आर हैविंग बिट ऑफ पेन. द पेन इज माइल्ड और इज इट सिवियर? Well, nurse, it is mild. Okay, then we have already given you painkiller. That's why you are having just mild pain. You need to bear this pain for the moment. But if you have any kind of moderate or severe pain, we will provide you the painkiller straight away. Is it all good? Okay. Now I would also like to tell you why I'm here. I'm here to tell you to give the information about how to take care of yourself after getting discharged and about the healing process. So now you are ready for the discharge. How are you feeling about going home? Nurse, well, I'm very happy to go home, but I'm really worried. You don't have to worry. I'm here to give you information about the care of your shoulder at home. As you know that we have given you sling, we have applied the sling over your arm to immobilize it. So you need to wear this sling for first 3 weeks. Is it all right? Okay. Also, doctor has given you painkillers which will help to relieve the pain. So for the first 3 to 4 days, you need to take these painkillers regularly. After that, you can take these painkillers as per the requirement. Also, for the mobility, you need to mobilize your elbow, wrist, and fingers, but do it very lightly so as to keep the blood circulation at good pace. But you need not mobilize your shoulder or arm. It is very important to keep it immobilized. Have you understood? Okay, that's great. So taking it further, I would like to ask you, do you have any pain even now? Well, nurse, I have told you that I am having just mild pain. Okay, so that's great. If you don't have any pain, that is great. And if you're just having mild pain, so you don't require the painkillers. But at home, you might feel pain. So take painkillers as per the requirement. Also, you need to apply the ice pack for 15 minutes after every few hours. Further, you will require extra support whenever you are sleeping. So may I know what kind of a job do you do, or are you retired or are you working? Well, nurse, I am a driver. Okay, so I would like to tell you, and I'm afraid to say that you will not be able to do driving for the first 2 to 3 months. So for now, you are not supposed to resume the driving. Is it clear? But nurse, how would I earn? Well, I'm sorry to say, but at this moment, your arm should be your priority. As you had a fracture, so obviously there are different stages of recovery. First, it would be the healing of the fracture, which will take 1.5 to 2 months. That is around 6 to 8 weeks. After that, you can resume your driving, and in 2 to 3 months, you would be able to do that. Full range of movement or strength would come in 3 to 4 months. So please avoid any kind of strenuous activities before 3 to 4 months. And for that also, you need to come over here for the checkup from the doctor. So please do not start doing any kind of activities by yourself, because there is risk of further injury. Also, it can prolong your recovery. For now, your movement would be restricted, and if you would drive, it can lead to inadequate control of vehicle and can lead to accident, which can be further fatal or dangerous. So please avoid these things. Last but not the least, I would like to tell you the next few steps, which are also very important to be followed, that you need to come up for the follow-up appointment in 2 weeks. And also physiotherapy sessions would be required, which would be commenced after 6 weeks. Is it all good? Okay. I reassure you that there is nothing to worry, but yes, recovery would take around 2 to 3 months and you would be able to resume your driving after 2 to 3 months. Till that time, you need not do any strenuous activities and need to take your painkillers as per the requirement. Also, come for the follow-up appointment after 2 weeks, and I reassure you there is nothing to worry and you are all good. Apart from this, I'm giving you this leaflet. It contains all the things which we have discussed just now. It contains all the information about fracture and the healing process. And if you need to contact us for any kind of complication or any kind of worry, there is a number on the leaflet. You can contact us anytime. All right. Okay, then take care. This is how you speak. And obviously, it will take some effort and practice. And I have spoken it 2 times for you just to make sure that everybody can understand. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967344256. And please subscribe our channel for as many videos of OET as you want. Thank you.